Hi, this is Dr. Christy DeSaffrey, founding physician of Bone and Body Women's Health. Happy New Year! Today I want to talk about our resolutions. Many of us goal-minded women have made New Year's resolutions and oftentimes find them difficult to stick with. I wanted to talk today about some motivation, particularly health motivation behind sticking to those New Year's resolutions. Many women I see make the most common resolutions are to drink less alcohol, to move more, and eat more healthily. But guess what? All three of those resolutions also will reduce your risk of breast cancer. We know this from the American College of American Cancer Society. Most recently released their updated information and statistics about breast cancer, citing that 30% of postmenopausal breast cancers are attributed to lifestyle or modifiable risk factors such as weight, alcohol consumption, tobacco, inactivity. So really important that when we think about, primarily let's take on alcohol. When we think about alcohol, 7 to 10 grams of alcohol, which is about one standard drink, increases the risk of breast cancer of about 10%. When you're drinking more like 2 to 3 drinks per day, or about 14 to 21 drinks per week, that increases your risk of breast cancer by 20 to 30% for postmenopausal women. So really the goal, when we think about January and we think about really beyond January, we want to be thinking about keeping our alcohol less than 3 standard drinks per week, which is what's really recommended. And we have shown that breast cancer risk is heavily linked to alcohol consumption, and particularly excess alcohol consumption. When we move on to physical inactivity and physical activity, we all want to move more. I think we can find lots of ways to do this. And we know when we move more, that also affects our lean muscle mass, our body mass. And we know that healthy weight postmenopausal women have a 20 to 30% decreased risk of postmenopausal breast cancer. When we think about things like activity, we think about things like nutrition. All of these things impact breast cancer risk as well as other cancer risks. We know that obesity is linked to 13 different types of cancer. Specifically, when we focus on breast cancer, again, thinking about your health goals and your New Year's resolutions, try and link those to other behaviors that we know are reducing our risk of cancers, and just being, again, more prevention minded, which I think, again, puts us on the better side of health. Prevention is the best cure. I hope to see you soon.